Morning. I see Mr. Goring. I'm at least. Morning, all. I don't quite see Katie yet, and I don't see our speakers yet, so. We can converse for a bit, and everyone had a good holiday weekend, and
I see Amy on.
hey, there's Amy.
Yeah, I'm not sure
I still don't see.
if Jessica is on yet.
Hello, Amy.
Hi there. Audio check sounds good?
Yep, it does.
Okay.
There's Katie. Hi, Katie.
Hi guys, sorry, back-to-back meetings. Thank God it's online today. Okay, well, I hit it right at the noon hour, so should I go ahead and get started?
I believe we have Amy on, so go
Good.
ahead and then
Yes.
we'll.
Good. Okay, well, good morning, good afternoon, I guess, now that it's officially noon. And welcome to the July 8th Rotary meeting online today. I think no special announcements. However, we'll start as always with the Pledge of Allegiance. So join me if you can. Let's see. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And we can stay standing. We'll take a moment to recognize members of the Rotary family who could benefit from our thoughts. I know that Karen let me know that Frankie Olison is in hospice. Does anyone have anyone else that could use some extra thoughts? Okay, hearing none others, let's just pause for a moment and send our thoughts out to anyone who would need them. Okay, please be seated. Hope you all had a wonderful, I guess I should go back. Karen, do we have any guests that I need to introduce today?
I do not see any.
Okay, I didn't think so, but. And anyway, hope you all had a wonderful weekend. Special thanks again to Mason for filling in for me for my first official president meeting. That's not a great look, but I promise I won't do that anymore. I had to make a quick trip up to Northwest Iowa. Hated to miss, but thrilled to be back with you all today. Excited for the next year. So again, with no special announcements, I think, Lisa, you could introduce our guest speaker today.
Yep, sounds good.
Thank
So
you.
we have two people speaking to us today about First Five. First, we have Amy Robak. She is a community health consultant for the First Five program with the Iowa Health and Human Services. Her role consists of working alongside First Five site coordinators and developmental support specialists to support their work with primary care providers, community partners, and families. Prior to being at Iowa HHS, she worked at Mid-Iowa Community Action as the First Five site coordinator and direct support specialist, which has strengthened her understanding of First Five at the local level. Throughout her years of working in the human services field, she has been dedicated to making a positive impact in the lives of Iowa children and families. I'll also add that Amy worked with me when I was with LSI, and she oversaw our crisis childcare program and did some parent meetings as well. We also have Jessica Miller, and she is the site coordinator for the First Five program of Micah in Story County. And Jessica has worked with First Five and Micah for a total of 14 and a half years in a variety of roles, including as a clerk for the WIC program, as a developmental support specialist for First Five, and now as a site coordinator for the last 4 years. Jessica has degrees in both sociology and English with minors in criminal justice and technical communications from Iowa State. And she has lived and worked in Story County for the majority of her life. And I will just add, I've had the opportunity to know both of them, and I currently serve as the board president for Micah. So I have learned a little bit more on this program. So I will turn it over. I'm not sure who's speaking first, but to Amy and to Jessica.
Thank you, Lisa. Yes, hello everyone. My name is Amy Robak. I want to start by also adding that Story County does have a special place in my heart because I really started my human services journey with Lisa at LSI. And I've had some great mentors along the way. I've made some great partnerships and connections. And so I was really excited to see this invitation come along and be able to talk about where we're at now with First Five, as well as what we're doing locally at Story County. So shall I go ahead and share my screen now? Is that okay? Or did you guys plan on sharing it on your end? Whichever is fine. I can do either.
Nope, go ahead.
Okay.
I'm not seeing it yet.
I have to get all 3 of my monitors lined up. It's quite the process. Okay, I'm going to share it now. Let me know if you can see it. Okay. Does it look good? Okay, and I'm going to try to skip ahead just to make sure that it's moving. Can you guys see the next slide? Okay, perfect. All right, so let's go ahead and get started then. I know this slide looks a little intimidating. There's a lot on here as far as the agenda and topics, but I really wanted to give a good overview and walk through each of these pieces. So we'll start with what is First Five, why are children referred to First Five, how does First Five work, where is First Five available in Iowa, the impact of First Five, what are people saying about First Five, and then Jessica will jump in with a local view of Story County. And hold on, now I can't find my notes. Give me a minute here. This one. No. Here we go. Okay, nice. So I'm gonna, just so you know, once I have my screen up on my monitor, I really can't see you guys. So if there's questions, I'll let Jessica unmute and just kind of tag me in there. Okay. All right, so what is First Five? So the First Five Healthy Mental Development Initiative increases the number of children with developmental concerns that are connected to needed resources and intervention services by a two-prong approach. So the first one is supporting healthcare providers' use of developmental screening and surveillance tools to identify developmental concerns, and then also connecting children with needs identified by their primary care provider to community resources and services through a locally employed developmental support specialist. And that's where Micah comes in. I also like to highlight on this slide that First Five is a free and voluntary program. There's only a few eligibility requirements, one of them being that the child has to be an Iowa resident. The child's age is birth up to their 5th birthday, and they are referred by their primary care provider. There are no other income or insurance eligibility requirements tied to First Five, which I think is really special because we know that developmental delays and concerns really can impact any family, and that support is needed regardless of those factors. Why First Five and why we're important? The first 5 years of a child's life are foundational for every child's health, learning, and behavior. And we know 90% of brain growth happens during this time. This is a key period for the development of skills and abilities that they'll need for school readiness and success. Since this is a period of rapid development, the brain is most adaptable during that time, which makes it the perfect and ideal time for impactful intervention. Unfortunately, an estimated 1 in 6 children are affected by developmental, behavioral, or learning issues, and only 20 to 30% of these children are identified before starting school. So again, why First Five is important is early screening and early intervention. In Iowa, over 90% of children under 5 are seen by at least one personal physician, being their primary care provider for those well-child checkups. Because primary care providers have access to nearly every child, they play an important role in early identification of developmental concerns, and that's why First Five partners with them to complete those screenings. While the AAP recommends universal developmental screening, less than a third of Iowa families with young children receive a developmental screening. Without routine screening, we know a primary care provider can only identify an estimated 30% of developmental issues. In contrast, primary care providers using standardized screening with a validated tool will identify approximately 70 to 80% of children with developmental delays. So there's a big difference when we're seeing providers that identify delays based on observations alone versus using a tool and having those discussions with parents. Additionally, the AAP recommends that children who screen positive are referred to early intervention, but only 59% of pediatricians report doing so. And this is the other piece of support that First Five provides, is making those connections with families. That way providers don't have that burden on them to do that piece of the work as well. Investment in developmental screening and connections to early intervention services supports a statewide approach to child health and success that, one, connects children to intervention services when they will have the most impact, promotes children's school readiness and success, and also saves money by decreasing deferred costs associated with school intervention services. So the data you'll be seeing over the next few slides are from fiscal year 23. So July 1, 2022 to June 30th, 2023. We just wrapped up fiscal year 24 last week, and so that data has not yet been analyzed. So just know that this is fiscal year 23 data. In fiscal year 23, First Five received 2,205 provider referrals. Out of those referrals, 2,196 had identified a reason for referral on that referral form. So that's just letting us know what concerns they're seeing and why they're referring to First Five. So 48% of those referrals were related to developmental concerns. 28% were for hearing and speech concerns. Another 10% were due to resource needs. 7% were due to family stress, and another 7% were for social behavioral concerns. And then 3% were noted as other. So you'll see that over, almost 75% or nearly 75% were related to development, speech, and hearing. Now I'm going to walk you through the First Five model, which takes you step by step through the First Five program. But before I start with step one, I also like to highlight that little green circle there that notes First Five supports healthcare practices and providers with implementing surveillance and screening. So before a provider even refers to First Five, we meet with them, we provide them the training and tools they need to implement screening and surveillance in their practice. And then we'll jump into step one, which is the primary care provider performs surveillance and screening for developmental, social, emotional delays and family stress. So once they've completed that screening, then they'll go into step two, which is the referral made to First Five, with those concerns noted on a one-step referral process, which is the First Five referral form. And then step three, the First Five developmental support specialists receives that referral and contacts the parent to link them to appropriate intervention services. And they remain in contact with them until those services are established and in place. And then the last step is First Five follows up with the provider, sharing updates on the status of the referral and intervention. So really closing that loop to make sure the provider knows the outcome of that referral, what services are in place. That way, when the kiddo goes back for their well child exam, the provider knows, can follow up on that referral to First Five with them. So where is First Five available? First Five supports screening and connections to community services and resources in 88 of Iowa's 99 counties. So we partner with the University of Iowa Child Health Specialty Clinics. We partner with over 300 primary healthcare practices throughout the state, over 600 primary healthcare providers. And we do this by working with 12 community-based organizations that employ the local site coordinator and developmental support specialists. So this map shows kind of our service delivery area for First Five. You'll see those counties that have the hashtags through them. Those counties are not currently covered by First Five. And then the MICA CSA area there is the turquoise number 7. So the impact of First Five, we'll talk about the connections we're making. First Five connects children and families again to those community-based resources to address those needs. We provide short-term support that is offered over the phone. So it's not a long-term case management. We connect them to those long-term services if that's what they're needing, but we're really the connecting piece. And then we also connect families to resources that can help address social determinants of health. So it's not just related to speech and hearing, but also those other needs that a family may have in addition to those primary reasons for referral. So in this image, you'll see we know that 97% of caregivers indicated that First Five mostly or completely met their family's needs. We also know that First Five goes above and beyond when assisting with additional needs that have been identified by the caregiver. So you'll see this graph that outlines all those additional needs that we may have assisted them with. And then, whoops, sorry. We also know that when working with the family, maybe during their well child exam, the provider might identify 1 or 2 concerns. But when that family starts working with First 5 and we're working with them over time, there's additional needs that comes out just by having those conversations with them. So, maybe mom just lost her job and she's needing help with finding employment, or their daycare lady got sick and now they need daycare assistance. But these are all additional needs that are not part of that initial referral to First 5. Let's see. We also know that most families that engage with First 5 receive connections to resources, as we made 2,508 referrals to community resources. And then something I also like to highlight down there at the bottom is that only 9% of referred children were unable to be contacted. First 5 lost contact with only 7% of referred children, and then only 7% refused referral services. So the majority of our families were connected with First 5. And I always like to share quotes because I think it's not only important to look at qualitative data and what we're doing, but it's equally important to look at quantitative data and how well we're doing it. So these are a few different quotes here from different audiences. So we have the referring primary care provider, we have First 5 staff, and we also have quotes from a parent of a child referred to First 5. So the referring primary provider shared, First 5 has made getting kids the help they need when identified so easy. The ease removes the issue of time being the barrier. I know First 5 will follow up. I know I will get timely response on identified needs, and they will work to overcome any barriers identified without needing more clearance or involvement from me. It is revolutionary and wonderful. And First 5 staff shared, First 5 is an expert in helping families get resource connected. This help frees up providers to support families with their healthcare needs. The family knows that there is someone to listen to them, providing validation, even when the barriers cannot be removed. Caregivers feel less stressed just having someone to talk to and problem solve with. And quotes from a parent include, every 2 to 3 weeks, First 5 followed up, seeing if I needed new resources. I knew I wouldn't fall through the cracks. When your child has special needs, you have so many resources and services being given to you, and First 5 can help you make sense of and organize it all.
Amy, we did have a couple questions come in.
Okay. I will go ahead and let me see if I can find my chat.
There's 3. It looks like there's 3 in the chat, and I can read them too if you can't find them.
Yeah, why don't you go ahead and do that so I don't have to.
So the first one was from Mason Adams. What is the strategy for reaching the 2/3 of young children that are not receiving a developmental screening, and the strategy for increasing the percentage of referrals? You referenced a 59% figure.
So that is what First 5 is working with providers on, is connecting with them, getting them to engage with First 5, providing that training and support. That is our goal, is to decrease the number of providers that aren't providing developmental screening. And I think like the work that Jessica is doing, connecting with providers, providing the training and support they need to understand why screening is important. I think that's our ongoing battle, is there's just some providers that, this is the way we've done it. This is the way it is in our practice. And they're not always open to change. But I think once we get one provider within a practice that partners with First 5, starts using our program, it's like using them as a champion to share with their peers. this is the difference that it's made in their work, the difference it's made in their practice, and in the families they're seeing. So that really is that's our goal, that's our work, is continuing to meet with providers to share the importance of screening and early intervention.
And the next question, go ahead, sorry.
Did that help, Mason, or do you have any follow-up questions?
No, you answered my questions. Thank you.
You're welcome.
And then Lisa asked, why are some areas not part of First Five?
Funding. We have not had an increase in funding in quite some time. I think it was 2017. So we would need a significant amount of funding, especially in some of those areas where they're highly populated areas. We just don't have the funding to quite get there yet.
And then Michael Kitchell, what are the standardized screening tests for development and social drivers of health?
The ASQ and the ASQSC, those are the two tools that our site coordinators provide training and the tools themselves. The MChat is another screening tool that we're also support providers in implementing. We see other ones such as the SWIC. I think those are as far as developmental screening goes, those are the main tools that we support providers in. And for surveillance, it's Bright Futures and the Cheddar. Yes, those are the two surveillance tools that you'll see.
And the last question from Michael, and I will actually answer this in my slides upcoming. He asked about McFarland Clinic engagement. So.
Oh yes, they're a great partner. All right.
I thought there was another question here, but it looks like it disappeared. So if somebody had another question, go ahead and throw it in the chat if you get a chance.
Okay. I'm gonna mute then. I think that was my last slide, and I will hand it over to Jessica.
And you can forward whenever you're ready, Amy. Like Amy said, I am Jessica Miller. I'm the First Five site coordinator for MICA, Mid-Iowa Community Action. We are service area 7 here in central Iowa. We serve 6 counties, including Story County. The other counties are Boone, Marshall, Tama, Jasper, and Poweshiek. We have 33 practices that we serve within those 6 counties. And 12 of those practices in the 33 are here in Story County. And to answer your question, we do partner with all of the McFarland clinics in Story County. There are 5 here in Ames. There is McFarland Pediatrics, and all of the providers at McFarland Pediatrics refer to us here in Ames. And we also partner with McFarland in Marshalltown as well. So let's see. We partner with McFarland East, West, North, and South in Ames, and as well as Nevada and Story City McFarland clinics. Primary health care in Ames, Story County Medical in Nevada and Maxwell, Nesco Family Medicine in Ziering, and then Unity Point Health in Huxley. And out of those 12 partnering practices, 10 of them do have at least one provider that refers to us. The other 2 just don't see very many children at all, but are still very interested in the information that we can provide if they do have a kiddo that comes in. Forward. So the local impact, we had 154 referrals received from Story County providers between June 1st of last year to June 30th of this year. I looked that up in my database just before this. And like I said, 10 out of the 12 partnering practices have referred to First Five in the last 12 months. The biggest needs that we see are speech is a huge one that we get referrals for, speech and hearing delays, as well as just global developmental and behavioral delays. And then a lot of basic needs, affordable housing, food insecurity, parent support, transportation in our rural communities, and then school readiness. So Some of the partners that we refer to here in Story County are Heartland AEA. Their AEA and early access programs are huge partners for us, as well as Early Head Start and Head Start here at Micah, and Drake Head Start for the Ames area. We refer a lot to our Micah Family Development programs, including the Food Pantry, the FADS program, also WIC. Child Serve is a big one here in Ames as well. For some of those basic needs, we refer to Salvation Army and United Way. And then family support, big ones are LSI and YSS here in Ames, as well as CFR. For childcare, we refer to the Child Care Resource and Referral Program, as well as other Iowa HHS programs. And for a lot of our families with autism concerns or waiting for autism diagnoses, we refer to the Iowa Regional Autism Program as well through Child Health from CHCS. So that is, I think, all I have. Oh, and then, so in first 5, we have had 2 state consultants that have provided resources for our providers, answering questions. They've worked with First 5 for many years, so answering questions that providers may have about implementation of the program, implementation of screenings into their practices. So last year we implemented a local peer consultant for each of our service areas. So we chose our champion at McFarland Pediatrics here in Ames. Her name is Dr. Tara Anderson. She has worked with First 5 since 2022 or 2020, sorry, and has been a champion for us just with developmental screenings and making referrals for First 5. That local peer support is available to partners related to, like I said, developmental screening, implementation workflow, and First 5 referral process. Just gives our providers in our service area a more localized person to talk to about any questions that they have. Let's see. Our peer consultant is familiar with screening implementation, clinic workflow, the First 5 referral process, and the challenges that can arise for busy providers as they establish their commitment to universal developmental screening and referral pathways to First 5. And I think we had a bunch of other questions come in here.
Yes, I answered one about the length of time this program has been in effect. So 2007, we really started with just a pilot study. And then over time, it has expanded into other regions of the state. And we have not, as far as regions go, it really hasn't changed since fiscal year 17. It's been the same state.
And I think we started here at Micah in 2009. I think was our first year with the pilot program.
Yeah, I think it was 2009, and it just was maybe like 1 or 2 counties, and then it expanded to include Tama, Hardin, and Boone. And so that area has even expanded over the last few years. And then I think Lewis had another question. Has this program had a beneficial effect on achievement score trends in early elementary grades? And that is an excellent idea and a great question. We have not been able to track First 5 children into their school or their grades specifically. We've really just tracked the progress of the connections we've made within the program and during their time within the program. But we do have a program evaluation being conducted by the University of Kansas. And they just signed on with First 5 maybe the past 3 years. And so they're really helping us with ways to look at our data and improve the collection that we're doing to demonstrate the impact. But this is a great idea.
And the last question.
Question for social determinants drivers, is there enough funding to help all needs? That is a great question. I'll answer a little piece of it, and then I think Jessica can answer more specific to Story County and what she's seeing. I feel like Story County has a lot more resources compared to other areas that I've worked in, or other areas that First Five covers. What we see a lot of is also wait lists. So not necessarily the funding isn't there, but just there's not enough people to serve families in order to get them assessed. And so there's wait lists that end up developing. One thing that First Five does in a way to address those wait lists is continuing to support the families. So even again, like that quote, going back to maybe we couldn't address those barriers within a month of working with the family, but even just adding that support, someone for them to talk to and help navigate applications and understanding what the programs are going to be offering, and following up with them to make sure they go to those appointments and assessments. That piece is something that First Five is really, really good at, and it's extremely important. But I will let Jessica speak to what she sees in Story County.
Yeah, Story County is a really, compared to even some of the other counties that we serve, for First Life with Micah, Story County is a really resource-rich county. We're really lucky to have a lot of community partners. As funding, there's never going to be enough funding for all programs, but we do have a lot of great partners, so we are able to connect families with the majority of the concerns that they have. We are able to connect families with resources within Story County usually. Like I said, some of the other counties are not as resource rich as Story County is, but we've got some great partners here. So.
And let's see, Kent's question, source of funding. So we are state funded. So every year we have appropriations from legislature, and that is where our funding comes from. Can you overcome county's budget shortfalls not participating? I'm not sure if I am understanding that question. Kent, can you speak to it a little more? Maybe. The 9 to 10 counties not participating. If we were to increase services to be statewide, it would take an increase in funding from the state to be able to do that. And each year we advocate for that. This year we are working again with KU to develop specific materials for stakeholders and legislators to kind of help share more about the work First Five is doing and the impact we're making. But that hasn't happened yet. And so each year we go into the year hoping that we'll get an increase. I do know that some sites, I don't think Micah does this, but some sites do seek other funding sources. But I don't think we've really seen that need so much within the current site. That's really just needing an increase to be able to cover those additional counties that don't have First Five services. Any more questions? You guys have been a really great bunch. I wanted to also kind of go back to Jessica's slide about the practices that are participating in First Five. Some things that I like to kind of highlight is not all providers within a practice are yet where we need them to be. So that is a lot of work that we're still also kind of working on is providers definitely see the value in referring to First Five and help us helping them and making those connections, taking that burden off of them. But they're not always willing to do the screening piece. And so that's a place that we're really trying to focus on is if they're going to refer to First Five, they have to do the screening piece too. I especially think, McFarland is a great example of they're doing all the right things. They've been one of our star champions for many, many years. And I think it's because as a practice, as a health system, they've implemented those requirements for their providers. Whereas other health systems or smaller clinics, it's more challenging to get those changes to happen. And so I just wanted to kind of note that is there still a lot of work to be done here at the practice level and the provider level.
And there was one more question that came in, Amy. I'm not sure if you saw it, but how many children or percent are under the poverty level and food insecure?
So we don't collect income level as part of our demographics because we don't have that eligibility requirement. So when we speak to parents, that is not one of the questions we ask. A lot of the times, I think by asking that question, you also might put a stigma on the program itself. And so if parents think that it's attached to an income requirement, they might not want to participate. And so that isn't a demographic that we collect, is poverty level or food insecurity. I think we could probably, I don't know if Jessica, you would know food if as far as that need goes, but not their income or poverty level. I will say that a lot of our families are on Medicaid. So that's one indicator that we can see in our data system is whether or not what their health insurance status is. So not necessarily their income or poverty level, but whether they're participating in Medicaid.
Yeah, and I don't have any numbers, but we do refer a lot to the WIC program, to local food pantries. Like I said, I don't have a specific number like Amy said, we don't track that, but we do make referrals quite a bit to the WIC program and food pantries and the SNAP program if they're eligible.
Another comment here, according to the newspaper, 50% of children in Collins are food insecure. I think we see that a lot in rural communities. There's just not the same resources that you would be able to access in Ames.
I do know, right? I was gonna say, I do know right now a lot of the community schools are doing food pickups and lunches and different things like that. I believe Collins is involved in that program. I'm not sure which school they're doing it at, but I know that's a big push, especially this year with the price of food and, food insecurity going up with everybody. I know there's a lot of, it was like a half a page last year of the schools and pantries that were doing lunches and different things, and it's like a 2-pager flyer now this year. So there's lots of schools participating in that this year in Story County.
And I want to use that, like Jessica shared, is a highlight for us as well, because First Five is like the resource guide for resources in their community. And so we know about resources that the provider might not know about or the family might know about. And that's not just to, say for food, but, back to school fairs and health fairs and shop with a cup and all these other activities that happen throughout the year. Is First Five and DSS do share those resources throughout the year with the families they're working with. It may not be something the family knows to ask about, so First Five is always sharing that just in case they might in the future, or just in case they have, a friend that might need that resource. We're really rich in knowing about resources available and knowing and having those partnerships in place to make those referrals.
All right, a lot of great questions. Thank you both so much. And thanks for answering all those additional questions. Thanks for sharing all about First Five. I wasn't familiar with that, so that's incredible. We're so lucky to live in a state that provides it to most of their counties, and also really lucky to live in Story County, where it sounds like we have a lot more offered here, luckily. So any other further questions for Amy or Jessica before we stand and do the four-way test? Okay, thanks again, Amy and Jessica. You guys are providing incredible work for our youth here.
Thanks
Thank
for
you
having
for
us.
inviting us. Thank you. Thank you again, Lisa.
Okay,
Bye.
so we'll do the four-way test. I'm standing like I'm going to do the Pledge of Allegiance, but of the things we think, say, or do, is it the truth? Is it fair to all concerned? Will it build goodwill and better friendship? Will it be beneficial to all concerned? Thank you all. Have a great rest of your Monday. And we'll see you next week.